Mr. Underwood.
Hello, my name is Brian Underwood. This is my wife and my son Reed. I want to tell you about my son Reed Davis Underwood, who is 1.5, and how we need Georgia to expand and pass HB-722 in its current language so that cannabis oil is a viable option for Reed. Can you imagine having to torture your child every day to keep them alive? To my wife, Audra, that is a reality that no parent should ever have to endure. Reed has a very rare genetic skin disease called recessive dystrophic epidermolysis bullosa, or RDEB. RDEB is the most tragic disease that you can imagine. Reed was born missing skin from his legs, hands, and back. With RDEB, Reed's body isn't able to produce a critical protein that binds the two layers of skin together. You can think of the protein collagen 7 as the glue that binds the skin and allows both layers to move together when friction is introduced. Without this protein, skin can blister or tear off with any rubbing or friction. This disease affects any tissue that has a junction where the collagen 7 is present, which includes external skin, the mouth, the esophagus, and the eyes. There is not one aspect of Reed's life that is not affected by RDEB. This damage can be created by basically anything: the seams of clothes, bumping furniture, acting like a normal baby, or a hug from his mom and dad. Whenever Reed blisters or his skin tears off, his skin has to be cleaned to keep infection away. Audra pours a bleach and water solution over his raw skin, as this is one of the only ways to effectively clean the wounds. Reed has chronic wounds that have a very hard time healing, especially as he's trying to be a mobile 1.5-year-old. I'm sure everyone can relate to getting a blister on your feet or hands and just how water stings. Now imagine that your whole leg from the shin down to your foot is completely raw, and you pour bleach and water on that wound. It is heartbreaking as a parent to see, and even more heartbreaking to be the parent that tortures your child to keep them alive. Reed goes through a bandage change every day where Audra will remove the dressings, look for new damage, and clean the area and apply new dressings. You never know what you'll find during this process. Audra has to take a hypodermic needle and puncture all the blisters on Reed's body. Without the protein that binds the skin together, the blisters will keep growing if they're not punctured. As soon as Reed sees the needle, he begins to scream because he knows the pain that he is about to experience. Reed will make a kissing sound or say "mama" in hopes that Audra will stop, but she can't. These blisters can form anywhere in the body, in the mouth, and in the esophagus. Reed underwent a bone marrow transplant in December of 2014 at 6 months old as part of a research trial conducted by Dr. Jacob Toller at the University of Minnesota. Reed was one of about 30 kids in the world to participate in this experimental treatment where his sister Avery would donate her healthy stem cells to Reed, and those stem cells could hopefully produce the missing protein. This is far from a cure, but intended to give better quality of life and hopefully arrest the progression of the disease. The disease is absolutely brutal. The lifespan for a child with RDEB is very short. Those who live into their teens face a life of extreme pain every day. The repeated damage fuses fingers and toes. They become crippled. The kids must have regular dilatations for esophageal strictures that narrow the esophagus. In most all cases, if infection does not kill the child, they develop an aggressive cancer called squamous cell carcinoma. These kids cannot eat regular food, and Reed has a feeding tube to get the nutrition that he needs. These kids get corneal abrasions when their eyelids stick to their corneas as they're sleeping, and when they open their eyes in the morning, their corneas are torn. The kids with severe RDEB that are old enough to communicate say that it feels like their skin is constantly on fire. These kids admit that they want to die because they can't take the pain. Reed takes methadone, Dilaudid, and Neurontin, and has been on morphine for pain. With the constant healing, RDEB kids itch a lot. Reed takes Ativan, Doxepin, Atarax, Benadryl, and voriconazole to help control the itching, but that doesn't come close to touching the issue. We recently found out that some other EB kids that have access to cannabis oil, and the results were amazing. The kids were able to get off and stay off their prescription narcotics. The oil relieved their pain, controlled their itching, and helped with inflammation. Although the narcotics help with the pain, they have side effects that are not good for a child with RDEB, including itching and constipation. It is not safe to be on these narcotics every day, and Reed has been on these since day one. These are the narcotics that are truly cause addiction and we have all seen the reports of how deadly these drugs can be. Reed's doctor, Jacob Toller, is absolutely brilliant and the most compassionate person you can imagine. All he cares about is helping to improve the quality of life for the kids that he treats. He treats them like they're his own kids. Dr. Toller is the only person in the world that we trust with the health of Reed. Dr. Toller fully supports the use of cannabis oil and will do anything to make it happen. He just pushed the Minnesota officials to expand the law to include intractable pain, which includes RDEB. I speak often to our pastor, Dr. Gil Watson at Northside United Methodist Church. Dr. Gil is well known in the Atlanta area and a great religious leader. Dr. Gil loves Reed and prays for him constantly. After researching the disease, Dr. Gil agreed that cannabis oil should be available for Reed and other people that need this oil as an option for their conditions. Dr. Gil wants a safe and accessible oil for Reed. People opposed to cannabis oil in general, or the expansion of the current law, need to look at Reed and what RDEB does to him. His pain is beyond comprehension for you and me. No one can imagine what it feels like to have bleach and water poured over the raw skin. It hurts you as a parent to hear the screams of your child. This is an issue that should be decided between a doctor and a patient. Reed's doctor wants the oil for Reed, and that should be all that is needed. No one that is making this decision to allow cannabis oil to be grown and dispersed in Georgia would ever let their child go through what Reed is going through without expanding this law. This law needs to be expanded to not only allow for growing and dispensing in Georgia, but also include more diseases like RDEB. The 1-to-1 ratio needs to be removed. Cannabis is a medicine, and levels of CBD and THC should be decided by a doctor or pharmacist. Again, Reed's pain level is unimaginable, and restricting components of the oil is keeping Reed from getting full benefits of the oil. The opposition to cannabis oil is completely filled with fear. They are convinced that something that was labeled as illegal can't have a medicinal purpose. Again, they would be fighting just like I am if they were in the same situation. Our society has been brainwashed that cannabis is bad. There's proof that it works in so many cases. Reed needs this oil as an option. Other people need this oil as an option. Breaking the law to bring the oil back into this state is unacceptable. The state government is forcing families to go outside of the state when they could be obtaining the oil from a legitimate lab here in Georgia. It is extremely cost prohibitive to keep the law as it is. The state is forcing the cost levels of the oil to stay high, as obtaining a strain that works can be hard to get and supply is limited to us in Georgia. It is absurd to expect families of special needs children to travel out of state and be burdened with extra travel costs. Reed has been denied twice now for Katie Beckett Medicaid, so we don't have the spare income to travel the U.S. to get Reed the oil that he needs. I hope that every representative and senator in the state looks at Reed's story and really evaluates their position. One family that we know that's using the oil for RDEB said the oil has completely changed their life. The child can sleep, pain is relieved, and the itching is controlled. The CBD has greatly helped with inflammation in the skin. Blistering is minimal when the inflammation is controlled. The THC has completely stopped the itching and will replace pharmaceutical narcotics for pain. There is no reason to fear cannabis oil. It is a natural and great alternative to the narcotics Reed is currently on. I am puzzled why some people are against cannabis oil, but somehow think that morphine, methadone, and Dilaudid are okay. If cannabis was developed by a pharmaceutical company, there is no doubt it would be widely used. On a final note, here's an excerpt from a poem that we find very relevant. It's called The Brave Little Soul. Not too long ago, in heaven, there was a little soul who took wonder in observing the world. He especially enjoyed the love he saw there and often expressed this joy with God. One day, however, the little soul was sad, for on this day he saw suffering in the world. He approached God and sadly asked, "Why do bad things happen? Why is there suffering in this world?" God paused for a moment and replied, "Little soul, do not be sad, for the suffering you see unlocks the love in people's heart." The little soul was confused. "What do you mean?" he asked. God replied, "Have you not noticed the goodness and love that is the offspring of that suffering? Look at how people come together, drop their differences, and show their love and compassion for those who suffer. All their other motivations disappear, and they become motivated by love alone. Show compassion for Reed, children with other diseases, and veterans, and pass HB-722 so that Reed and others can have a safe option for a better life."
Mr. Underwood, would you stand for a question or two?
Yes.
Representative Atwood.
Mr. Underwood, thank you for being here. I'm very sorry about your son. Could you, it did help Reed. The cannabis that you've been taking has been positive for him?
Well, it's illegal here, so we're going based off of friends that have children with the same disease.
You've heard other reports from other children,
Yes.
parents, that it helps. Is it, I think I heard it, but I want to be sure. Is it, are you able to back off the opiates?
The people that have taken the oil have come up with their opiates.
I do know that they used to teach this stuff, that it does cause extreme concentration. Would it be possible for you to either write down or hand me the name of the disease that Reed unfortunately has?
Definitely.
Appreciate that. Thank you, sir.
And yeah, his doctor in Minnesota is a world-renowned doctor, and he is fully in favor of this and knows the level of pain that Reed is experiencing on a daily basis. And he says that this needs to be an option.
Representative Peake has whispered to me that it's in the bill. Is that right, Representative Peake?
That's correct. It is line 74 in the current draft of the bill.
I expect that will be carried over to the sub.
That's correct.
Thank you, Mr. Underwood. Mrs. Underwood.